Hi everyone, my name is Mark Moeremans and I am the CEO at Spectrum Medical Care Center. Spectrum Medical is Arizona's premier destination for LGBTQ healthcare. We've been around for almost 30 years and specialize in primary care, sexual health, gender-affirming care, and HIV treatment. We started as an HIV treatment center back in the 90s, and our mission is to advance the health and well-being of Arizona's LGBTQ population and those living with HIV. As a community, we have made great strides in the fight against HIV. Unfortunately, the war isn't over yet, and until we have a true cure for HIV, we'll need to continue to prioritize prevention efforts. Unfortunately, the data and numbers here in Arizona aren't as promising as we'd like to see. We've seen a resurgence in HIV cases across the valley and across the state, and as additional healthcare funding cuts continue to happen for clinics across the state and across the country, we're seeing a continued rise in those numbers as well. It's more important than ever that we continue to protect ourselves using tools like PrEP, and that our communities support one another in the prevention and fight against HIV. That's why I'm so proud to work at a place like Spectrum Medical, where we're on the front lines of that fight. Our mobile units are providing free testing out in the community. Our PrEP navigators are helping connect patients with the right care for them. And really, what we want to do is create an end to the epidemic and fight HIV firsthand. PrEP is an amazing tool in the fight against HIV. PrEP stands for pre-exposure prophylaxis and was originally FDA approved over 12 years ago and was the first major breakthrough in the fight against HIV. PrEP comes in many different forms, whether it's a daily pill, a 2-month injectable, or now a 6-month injectable with a new drug named lenacapavir. PrEP is so important to our community because it puts the power back in our hands, and by taking our health into our own control, it allows us to stop and prevent the spread of HIV. I've been on PrEP for over 10 years, and it has changed my life and how I think about my health care and my sexual protection. Yeztugo is the new 6-month injectable PrEP that was just FDA approved last June and is the latest breakthrough in HIV prevention. Yeztugo is a great option for a lot of different types of people. I know for myself, I'm considering it because I've been on the daily pill for over 10 years, and for me, I think I just want the convenience of a 6-month injectable without having to worry about prescription refills, or if I forget to take the pill, or if I'm traveling. I think people looking for peace of mind, ease, and convenience, the 6-month injectable is a great option. There's others who might want to consider it as well, whether discretion is important for you and you don't want pill bottles sitting around, or maybe booking out medical appointments every 3 months for refills becomes too much of a hassle. Women are also looking at Yeztugo in a new way because this is the drug that had the most women included in clinical trials of all PrEP options. So I think a lot of people interested in HIV prevention or how to protect their health who want convenience, ease, and peace of mind, this is a really great option. I want to share a little bit about my PrEP journey, both personally as I'm making the decision to get on the new 6-month injectable Yeztugo, but also about what it means to be a PrEP patient here at Spectrum Medical. We have an unbelievable care team that's going to help guide me through the process of getting on Yeztugo, but I want you as a potential patient to understand what it might look like to become a patient at Spectrum and start your PrEP journey with us today. So join me, come with me on this journey and see what it's like to set up a PrEP appointment with Spectrum and receive the 6-month injectable Yeztugo. For patients or prospective patients who might be interested in Yeztugo, Spectrum Medical is one of the first and only clinics around the valley that is providing the drug. So I'd recommend you call and schedule an appointment with our care team, and would love to walk you through what that journey looks like. Once you've got your appointment scheduled to potentially get on Yeztugo, we'd connect you with our PrEP navigators for your first appointment. There, they'll discuss the different PrEP options that you have available to you, and if both parties and your care team agree that PrEP is the right drug, you'd move towards an STI screen blood test before scheduling a follow-up appointment where you actually receive the injection. In between those two appointments, our care team is helping with insurance prior authorization to make sure that your insurance covers the drug, ordering, and then making sure that you're scheduled to come back in for the follow-up. At that point, you'd receive your 6-month injection, as well as a few other materials and information to make sure that you've got everything you need for protection for the next 6 months.